welcome everyone to the 2023 Research Grant announcement. I am Rachel Chowdhury, Sigma Foundation for Nursing Board Treasurer. And on behalf of the board, I thank you for your donations and for joining us today. Your donations to the Foundation's Research Permanent Fund make possible the grants that are awarded annually to nurse researchers around the world. We received about 100 grant applications from 6 global regions for the 1 December research grants deadline, and we'll be funding 16 small grants to researchers in 4 global regions in June. Today, we have 4 of those recipients with us to give you an overview of their study that will be conducted over the coming year. I am pleased to first announce or introduce to you Dr. Nita Matthew Joseph of the University of Texas Health Science Center, Houston in the United States, who will give us an overview of the study, perspectives on physical activity participation in middle-aged U.S., South Asian Indian women at risk for type 2 diabetes.
Thank you, Ms. Chowdhury. Hello, good morning to all of you. First of all, thank you, Sigma, for funding the research grant for our research titled Perspective on Physical Activity Participation in Middle-Aged U.S. South Asian Indian Women at Risk for Developing Type 2 Diabetes. The purpose of this study is to explore the culturally bound attitudes, behaviors, beliefs, and barriers related to physical activity among middle-aged U.S. South Asian Indian women at high risk for developing type 2 diabetes. This is a descriptive qualitative study using focus groups. The data will be collected using a demographic questionnaire and semi-structured interview guide for this focus group. Participants will be recruited from various Indian religious or faith organizations, community and professional organizations. Participants will be receiving $25 gift card upon completion of the focus groups. We hope that this study will provide critical data needed to design culturally appropriate physical activity intervention for this population. The data gathered are expected to contribute the national goals of reducing health disparities among minority groups by reducing chronic condition for the future development and testing of intervention to promote physical activity. Thank you for listening to my presentation.
Thank you, Dr. Joseph. Joining us next is Dr. Joshua Pratt-Dallabrook of the University of Pittsburgh in the United States, who will tell us about his study developing a nurse practitioner integration model.
Thank you for the introduction, Dr. Chowdhury. I am grateful for this research opportunity provided by Sigma. I'm Dr. Josh Pratt-Dallabrook, an assistant professor at the University of Pittsburgh School of Nursing. My research focuses on national level health policy affecting the nursing workforce. Nurse practitioners are becoming increasingly common around the world. They are a popular workforce because evidence shows that their care is associated with positive patient outcomes, such as improving access to care and addressing health disparities. Introducing the nurse practitioner role alone, however, does not guarantee that they will realize these goals. Attention must be placed on policies affecting the successful integration of nurse practitioners into the health system and care teams at a point which they can practice to the full extent of their training and scope of practice. Internationally, little is known about policies and practices about integrating nurse practitioners into health systems. Policymakers and care organization managers lack sufficient information to guide policies. Furthermore, there's little understanding of how the extent of integration of nurse practitioners affects their ability to address patient outcomes such as health disparities. In the Sigma-funded study, we are building on a prior conceptual work to develop a model for integrating nurse practitioners. We'll use a Delphi study, which is a method for surveying experts with both closed and open-ended responses. These participants will be nurse practitioners, organizational administrators and policymakers, and scholars with expertise and/or experience with integrating nurse practitioners into different aspects of the health system. The experts will help us identify the facilitators and barriers affecting the integration of nurse practitioners and how integration is related to the ability for nurse practitioners to effectively address health disparities. These participants will receive multiple rounds of surveys until expert consensus is reached on this model. And the study will be conducted as an international partnership with the University of Pittsburgh, Ben-Gurion University in Israel, and the University of Pennsylvania. The study's co-investigator is Dr. Rebecca Clark at the University of Pennsylvania School of Nursing. Thank you.
Thank you, Dr. Pratt-Dollerbrook. Next with us is Dr. Pamela Wright of the University of South Carolina in the United States, whose study is biopsychosocial perspectives and healthcare concerns and needs among postmenopausal women with PCOS, a qualitative study.
Hello, everyone. I would first like to thank Sigma Foundation and the donors for this opportunity. Overall, my research foci are to improve symptom management, reduce the risk of comorbidities, and improve physical and psychological health outcomes among women with polycystic ovary syndrome across the lifespan. Polycystic ovary syndrome, or PCOS, as I will call it. PCOS is a chronic condition involving hormonal dysregulation that impacts about 1 in 5 women globally across all races and ethnicities. Given its association with menstrual dysfunction, PCOS is typically diagnosed during the reproductive years. However, its other clinical features, such as central obesity, insulin resistance, and dyslipidemia, continue to challenge women over the lifespan and is compounded with the increased risk or concurrent development of cardiometabolic diseases and reproductive cancers. In addition, women with PCOS are 3 to 8 times more likely to have depressive symptoms and 7 times more likely to attempt suicide than women without PCOS. These psychological concerns do not disappear with age, and as such, PCOS transcends the reproductive years. Biological and social health determinants change across a woman's lifespan, while gender and age inequalities increase a woman's vulnerability to the risk of preventable illness or disease. However, there is limited quantitative research and an absence of qualitative data about postmenopausal women with PCOS. As a result, treatment guidelines and routine screening recommendations are incomplete, while also lacking a person-centered focus and an understanding of PCOS in the context of aging. In a preliminary study, I administered a health-related quality of life survey with one open-ended user about their perspectives of PCOS in relation to aging. Findings revealed that older women with PCOS frequently felt dismissed by healthcare providers and frustrated with the lack of healthcare information for PCOS symptoms other than fertility. The findings from this preliminary study, the scarce research about the topic, and the increased health risk experienced by women with PCOS as they aged served as the impetuses for this funded study. Thus, the purpose of this proposed study is to explore person-centered physical and psychosocial factors and healthcare concerns and needs associated with aging among postmenopausal women with PCOS. We aim to recruit at least 25 participants using flyers, the snowball method, social media, and research match. Inclusion criteria are postmenopausal women age 43 and older, the ability to read and speak English, and audio conferencing capability through a personal digital device such as a laptop or smartphone. An exclusion criterion is medically induced menopause. Participants will be interviewed virtually using either Teams or Zoom, and the transcripts from the interviews will be analyzed using the steps of reflexive thematic analysis as described by Braun and Clark. Besides me, the research team includes 2 other nurse scientists with expertise in chronic care management and qualitative research and analysis. We have worked together for 5 years and have several published manuscripts about the therapeutic management of PCOS. Expected findings from this funded study will include 3 things. 1, common experiences of coping with the chronic condition and life course changes. 2, knowledge about the facilitators and barriers to healthy aging among peri-postmenopausal women with PCOS. And 3, person-centered implications for practice and further research. I sincerely appreciate the opportunity to conduct this research, which is for an underserved population of greater than 20 million women. Again, thank you for your support.
Thank you, Dr. Wright. The last grant recipient with us today is Dr. Yang Yu of the University of Rochester in the United States, whose study is maternal malnutrition and adverse birth outcomes following bariatric surgery, insights from a national sample.
Thank you for the introduction, Dr. Chaudhary. First, I would like to express my gratitude to the Sigma Foundation for funding my research. So the overall background of my study is that obesity and severe obesity are highly prevalent among women of reproductive age in the US. Compared to women of a healthy BMI, those with obesity are at higher risk for pregnancy complications, adverse birth outcomes, and long-term impairment in the health of offspring. Therefore, to curb the negative consequences of maternal obesity, women actively seek and undergo bariatric surgery, which is the most effective treatment for obesity that yields durable weight loss and comorbidity remission. Pre-pregnancy bariatric surgery has well-studied benefits for both mothers and neonates, such as reduced incidence of gestational diabetes and fetal macrosomia. However, as the surgery radically alters the GI physiology and function, limiting the food that can be consumed or absorbed, there are serious concerns about maternal malnutrition and consequent unintended birth outcomes. Currently, a scarce number of studies have examined maternal nutritional status following bariatric surgery, and there were mixed data about birth outcomes. Hence, to bridge the gap, this study is designed to provide greater insight into maternal malnutrition and adverse birth outcomes following bariatric surgery. We will use the National Inpatient Sample, which is the largest inpatient database in the US, to accomplish 3 specific aims. The first is to analyze the temporal trend of deliveries following bariatric surgery. The second is generate nationally representative prevalence of malnutrition and adverse birth outcomes among pregnant women post-bariatric surgery, and compare that to a propensity score-matched non-surgical comparison group. And the final aim is to determine whether and to what extent malnutrition is associated with risk of adverse birth outcomes. Indexes of malnutrition include calorie protein deficiency, micronutrient deficiency, and deficiency anemia. Adverse birth outcomes include growth restriction, small for gestational age infants, preterm birth, low birth weight, birth defects, and stillbirth. I hope findings will have the ability to inform obstetrical counseling and care to improve pregnancy outcomes in the growing population of women who conceive post-bariatric surgery. Thank you very much for your support.
Thank you, Dr. Yu. I welcome our Sigma Vice President, Gloria Chan.
Good morning, good afternoon, or good evening, wherever and whenever in the world you are joining us today. Thank you, Rachel, for emceeing our webinar today. I would like to truly give a heartfelt thank you to all our foundation donors for making this session and our grants possible. And on behalf of the Sigma Board of Directors, congratulations to all our grant recipients for your impactful nursing research. Thank you.
Thank you, Vice President Chan. And of course, President Madigan commented, we're glad to support your work. We look forward to seeing the results. I should say CEO. Our president is Dr. Ken Dion, sorry. All right, so lots of congratulations to our recipients and scholars, yes. Yes, and Dr. Prevost, another past president of Sigma, is excited to hear your work and would like for all of you to please stay connected in Sigma. And we again are looking forward to the results of your study. I thank again all of our 2023 research grant recipients for joining us this morning. We are wishing you continued success throughout your research project as you embark on them and also your professional career. We thank the foundation donors on the call and ask that you please continue to donate annually so that important nursing research are supported. Please share what you heard today with our fellow Sigma colleagues and other non-member colleagues in the nursing profession. Please encourage them to donate through our nursing research at Sigma Foundation for Nursing.